Geisinger's home health program serves around 4,000 Geisinger Gold members by bringing health care to them in a variety of ways.
Someone gets placed with Geisinger at home, pretty much they receive a whole secondary team of medical professionals. They get our medical director for Geisinger at home, they get a provider, they get a nurse, and they get a health assistant, which is what I am. We're more so community resources. So depending on how sick they are or if they have any issues, that debates on when the nurse sees them, every 4 weeks, every 6 weeks, every week, depending. And they get checked by the provider every couple of months. Doctors will make special visits here personally, or we'll do our telehealth, which we find it very easy to do. The health assistants travel and we get the doctor on the telehealth equipment.
It's just amazing. And I told the young ladies this when they came here, and after a while, I've seen about 6 or 7 different nurses that have come here. And I also saw Dr. Pupo. He's my man now, I call. But I told them that I think Geisinger actually picked the best people to put them on this program, because they've all been, how do I say it? They've been, I don't want to say wonderful, but that they are that, but it's even more than that.
Evangelical-Community-Hospital employs telemedicine in a number of ways to get patients faster access to specialists.
But instead of having a laptop, we have this device here, which is a little bit more mobile, and we put it right at the foot of the bed, and the doctor will show up here, and the patient can talk to the doctor. There's 2 cameras on here. There's like a wide angle camera, and then one that can narrow in, and we can see pupil reactions real close up, so it's very neat to have that expertise, within minutes.
A lot of Geisinger at home patients are older. So when we come in with this computer, it's so fun to see their reactions. They're like, oh my gosh, the doctor can hear my heart and lungs over the computer. They can look, if they have wounds, we have a special camera we can hook up and we can get all up close and personal with wounds so doctors can see that on the other side and treat if it's necessary through the computer. It is really cool, the benefits that we can provide in the home with it.
We use this for our stroke patients. We have neurologists here. As you can imagine, they have very busy office practices, and if they kept getting pulled down every time we had a stroke patient come in, you'd have a waiting room full of unhappy patients. So we can have this level of expertise within minutes and let the physicians see their patients upstairs, and meanwhile these doctors can get in the medical record. They can see the images, the CT images, as soon as they're completed here. So it's a great service.
It has saved us a lot of trips to Geisinger. And they do it all. Whatever I need done, if possible, they do it.
So anything that we say is a secure conversation, and the way the devices work that Carrie has, for example, she has a stethoscope that I can actually listen to through voice canceling headphones on the other end.
Upper left.
Good, excellent.
And upper right.